another one of our COVID-19 shows. Very proud to have on today a good friend and a good friend of our community and our medical community in and around Central Illinois, Dr. Ken. Hey, good to see you, my friend. Thanks for coming on. Can you hear me, Ken?
We got you back. I think we just had a little glitch there. We're good now, sir.
Yep. Well, you missed my good intro, but hey,
can you do it again?
Welcome to being on. Yeah. I can't remember everything I said. I would never do it justice, but I do want to say thanks for coming on, Doc. I know you're busy. I know it's a very busy time and an interesting time to be in the medical community.
Yep.
And really, that's what I wanted to have you on, so you could answer our questions and some of possibly our viewer questions too. But
absolutely.
Go ahead and just give us a little background of where you're at, what you do at Springfield Clinic, and a little history of you in the medical community in Springfield.
Well, I started out here in 1997, actually in Lincoln. I joined the Springfield Clinic. I went to SIU for undergrad, med school, and residency. So I did all 12 years straight through SIU. So grew up in Marion, ended up here, went to med school, residency. And then when I came out, I joined the Springfield Clinic, but I joined in satellite in Lincoln, Illinois. So I spent about 16 years there. And then kind of moved down here to Springfield, had some other things to do as far as being a medical director. It was just a situation where I needed to be closer to the main hub, so to speak, in Springfield. And since then, a few years ago, I was made chief medical officer. So I do that about half time. The other half time, I've got my practice in Sherman. So we live up there and lived there for a long time. So,
well, we appreciate you coming on. And as chief medical officer of Springfield Clinic, tell us, how has the clinic been impacted by this fight against COVID-19 and the measures also implemented by state and federal governments?
Yeah, I think pretty much similar to everybody else, right? I think if you look around the country, it's sort of a weird deal. There's certain areas that are extremely impacted from a standpoint of multiple patients with COVID, and the ERs and the ICUs are overrun. We were definitely prepared to have that happen. We worked in concert with the major players in Springfield and the area. So Memorial Medical Center, St. John's Hospital, and SIU School of Medicine, and the Springfield Clinic were all sort of working in concert to try to prepare for that. If, at the beginning, we weren't sure what was going to happen. And I think appropriately so, we just sort of, everybody shut down, sort of looked at processes, what do we have to do? And then sort of as we've moved along, I think the government, rightfully so, and people have looked at, should we look at this a little bit differently? Is this going to happen to us? And are there some other things we can do? Because we might be sort of hurting the medical our patients by not being open, shutting things down, not making things available. And again, as you read through the papers and the news about some of these stories where people have put off needed care, I think that that's become very concerning to people around the country. So our main goal was to just say, look, if maybe it is, we need to look at this a little bit differently. And again, appreciate the folks at the governor's office and you working with them to sort of open this up a little bit in stages, right? We want to do that appropriately, but to let people know, hey, it's safe to come to the Springfield Clinic or to your medical facilities, right? We that should be the safest place to go. And so I think that we need to continue just to let people know that. So,
well, I've witnessed it. As a matter of fact, my wife got a diagnostic procedure done. She's a colon cancer survivor. So she had a regular checkup for the diagnostic procedure she has to go through. And it was the last day before the elective procedures were closed in the state. I had no idea that her luck would be that good. She'd get the procedure in. But you were doing screening when we walked in that morning. And as a matter of fact, my son had to get an ultrasound procedure that had already been previously scheduled a few days later. And you had those same screening procedures in place. You were already practicing proper screening measures and making sure you did your best to mitigate the spread of COVID-19. But you also had elective procedures and diagnostic procedures shut down, and couple that with the fear that people have had to go get access to medical care. I mean, our biggest fear, which is why I urged the governor and his team, and I got to say thank you to them for listening. I urge them because we don't want to have a higher death rate of diseases that we know how to face coming out of COVID-19 because people were too scared to come see you or they didn't have access. So tell us what this new guidance that came out on April 30th Tell me what that's going to do for you and the clinic, and how it's impacted your ability to serve patients.
Well, I think the good thing about it is that people did recognize that there was this issue. And, certain things that are elective, however you define that, a month or two ago, cease being elective after you let them go for a couple months, right? Colon cancer screenings, potentially, other screenings that you might do, certain surgeries that you might want to wait a month, maybe taking that mole off can wait a month, but you get into 2-3 months, it starts to get a little hectic. So I think on a good note, they looked at that and wanted to put in parameters to make sure that, okay, we still don't know exactly what we're dealing with here. This is a new virus. We're still trying to get a sense of it. So to put some common sense parameters around how do we get people back in, recognizing the fact that, A, we need to get folks in for these procedures. No one wants to look back and say we had all these things happen that really we could have prevented. Secondly, and I think this is a real issue, particularly for some of the smaller areas in the state, it's a financial issue, right? I mean, when you're shutting everything down and doing all this, and you don't really have any cases around, and your ERs are empty and your beds are empty and clinics are empty, that becomes a major problem long term, because if you have to shut down, you're not going to help anybody's health down the road. So I think looking at that, particularly from a standpoint of making sure the procedures were in place and processes were in place as you walked into the door. All the facilities have to meet those criteria, as you know, Rodney, with having to do pre-screening questionnaires when you go in there. You walk in, everybody's got a mask. You're going to have a mask, these types of things. And then as you go in necessarily for a procedure into a surgery center, they're going to do it again. They're going to look at you. You're going to be tested. The rule is 72 hours prior to your test or to your procedure, you have to have that test done. And that's a fairly tight timeline. But it's hard and fast rule. So I think, at our clinic and at the other facilities around, you don't have that test and you're having an elective procedure, you're not getting that procedure. So I think under those parameters, that does give us some ability to start to open this up a little bit and start treating our patients like we want to.
Well, good. Now that process is opening up. You saw some concerns with being able to get CDC guidelines to fit within the existing testing capacity we have in Springfield to be able to allow patients in. Number one, how is that process of reopening for these elective procedures that many would call life-saving procedures, as you mentioned earlier? How has that process been going? When do you expect to be at somewhat full capacity? And how has your ability to work with some outside partners really helped you to have testing capabilities in the Springfield and Central Illinois area to get these patients tested before they come in for that colon screening, for that skin cancer screening, for that other diagnostic proceeding?
Yeah, so we've been very fortunate in that sort of fashion. As you know, early on, the CDC guidelines were in a tough spot because they knew what kind of guidelines we needed. Again, it's all in flux, but the testing just wasn't available. We all know that. It's been, ad nauseum, right? And as time went on, to folks' credit, they just tried to ramp up. Various companies tried to ramp up. We try to use the more well-established companies. Obviously, you've seen that there's various other people coming out with tests. But we've been fortunate in that we've been able to start securing some tests. They have all been send-out tests to this point. We have not been able to secure any on-site testing for ourselves. And I think those were more reserved, and we've actually been told those were reserved for bigger hotspots, bigger cities where they were having more problems, where they needed urgent testing. I think eventually in the next month or two, we're going to be able to get some of that here at our various facilities. So that was sort of where we were at for a while. We were sending things out as we needed those. The partnerships have actually been very helpful. As mentioned before, the different institutions around this area, we sort of all partnered to conserve resources and to conserve testing. We all got on the same sort of platform about how we wanted to test following the guidelines. IDPH was extremely helpful for us in that regard, particularly as they ramped up the testing, allowing us to guide what exactly we needed to do. And so getting that together, we set up a couple testing centers amongst the 4 groups here where it really worked smoothly, where everybody knew here's where you went to get testing if you had these parameters. Okay. Now that this has come along, it's a little bit different, and not to sort of give you a big head or anything, but we've really have to thank you for everything that you've done to bring in our other partner, which is Walgreens. I know it was instrumental. Our problem was we were going to have trouble getting, and a lot of us around here were going to have trouble in 72 hours getting those tests done because they're send outs. And to get that done that quickly, you know how many variables go into that. Someone has to get it to send it out. It has to be sent out. The processor has to on and on and on. Then you have to get the result. And those go to various lab or Quest in various places. But being able to get our ability for you to set it up and help us pair with Walgreens to get on-site testing, because that's what we don't have. So our folks can go there and get testing within 15 or 30 minutes, have a result, and know that, okay, I'm negative, I can go get my procedure, or if I'm positive, I can't get my procedure, and I need to go ahead and make other people aware and reschedule. That has been instrumental in what we're able to do in this area.
Well, thank you, Doc. I mean, it's been a privilege to be able to work with you, the clinic, and also Walgreens. Look, I was really excited to tour that Walgreens facility with my good friend and colleague Darren LaHood, and also Representative Tim Butler and Mike Murphy, two other good friends and colleagues. We saw the capacity that they had there with 5 Abbott rapid testing machines, and seeing the governor put in that testing requirement. Speaking with your team there at Springfield Clinic, we wanted to partner up, but we had some issues beforehand with the CDC guidance and only testing symptomatic patients. I got to give the Trump administration and the health officials there at CDC some credit. We asked them to put in an exception, and within hours that same day they did. And we're able to create these partnerships that allow you to work with companies like Walgreens and use the existing capacity that's there. I trust that relationship, that partnership is working well.
Yeah, so far. So even I think to what I didn't answer the question before, unfortunately, as far as how is that going, what have we implemented? We've already started testing folks, trying to get trial runs, because the 11th is the date where it sets up, right? So we want to make sure to get as full capacity as we can with these by next week. And we don't want anything falling through the cracks. So you always try to trial it and pilot a little bit. And so far, pretty good. That turnaround time there it's really nice as a patient to be able to go there, test, and then you have a result there while you wait. It's just been very helpful for the patient and for everybody involved. So thanks again.
Oh no, it's an honor. It's an honor to work with you guys at Springfield Clinic, and you guys are our provider, our primary care provider for my family and the families that I serve here in Central Illinois. But it's just not limited to Springfield Clinic. This is every medical facility in the state, every facility in and around the 13th district. And we're glad to see you as an example of how we begin to reopen parts of our economy. And the health of every individual matters. And you've got to be able to without fear, walk into a clinic, get the health care you need to make sure you can fight diseases that aren't related to COVID-19. So keep up the good work there. But Doc, you did mention the increased testing capacity and what you've seen from the beginning of COVID-19 and our fight against it to where we are today. With the increased testing capacity, what can I take back to my colleagues in Washington so that we can still assist in increasing that capacity? And what may be some other needs that you and your colleagues at Springfield Clinic have seen?
Well, I think the number one thing is continue to be vigilant, right? We don't know where this is going. We don't know that there might be another bump coming up into the summer, into the fall. As we start to open up things, we're going to be vigilant. I think out in DC, I think what would be really helpful is to continue just to listen as you have to what we need on the ground level. Whether it's the testing, whether it's the PPE that everybody's heard about, because that was really scary at first. We weren't sure we were going to have enough equipment to treat people and to protect the people that work at the clinic and the hospitals. That's a scary sort of situation to be in. I think that's sort of, while not perfect, and there's shortages here and there, I think that's really improved. And I think just that comes from listening to the people on the ground level saying, hey, here's what we need. We've got to get this. We need this. We need this. And I think we've been actually very pleased with the response that we've had. I can't say enough about where we've been. In such a short time, it seems like it's been months and months and months, but it really has been about a month and a half where this has all happened. It's amazing how far we've come during that time. So yeah, keep listening to the folks. Keep working on that testing. We do need more testing. That's a definite sort of thing, to the point where we can get testing on site for a lot of us makes a huge difference.
Well, that's why we've seen the ability to have partnerships with on-site testing at the Walgreens facility in Springfield. Glad to see that happen, but I'll take your advice back to Washington, D.C., and it's much appreciated, Doc. We're moving ahead in trying to look at the governor's regional phased-in approach that was announced just yesterday, and how we begin to look at some of the rural areas you and I live in that are much different than a lot of the urban areas.
Sure.
As you see us move toward a more regional approach, what do you think Springfield Clinic's role, especially now after you have the ability to provide more primary care access, you have the ability to provide more diagnostic tools and procedures for patients. What do you see your role in that regional approach to reopening through the phases the governor announced yesterday being?
Yeah, I think we have a couple of roles. First of all, we have multiple sites down in even south of here in the rural communities, north of here. We have a pretty big footprint to sort of watch. To be truthful, the hospitals in a lot of those communities have been very helpful to work with. We kind of mentioned all the ones in the Springfield hub, but you talk about down in Hillsborough and Litchfield and Carlinville and going all the way up to Macomb and Lincoln. These have been very, helpful. Everybody's so engaged. Everybody wants to do the right thing. And I think what we can do from a clinic is, again, if you look at, people are afraid. And I think as you show folks that really coming into a clinic or coming in and getting care is not something that you need to be afraid of. And once you start to break down that wall and they look around the community and they see other folks are doing things and maybe things are opening up slowly, that they start to be less afraid, and they're able to do the things that they need to do to take care of their health. And so I think from our standpoint, we can be sort of a leader to show people, hey, you do the right things. You do your social distancing and you do your masking and you do hand washing and the basics, and we'll take care of our end. And if they see that, I think that goes a long way to showing people to get rid of some of that fear, because I do think at some point the fear outweighs everything else.
It does. And I appreciate your willingness to recognize that. That's something that I believe needs to change so that people feel like they can go to their primary health care facility and get access to care. Our emergency rooms aren't busy because people are afraid to walk into them. I was on the phone with some primary health care centers today from throughout my district, and there's been such an increase in telehealth visits for mental health and issues, what we've seen via the lockdown and the stay-at-home orders. So those are the reasons why people need to come get care that Springfield Clinic and others can now provide them. One thing that we're seeing too, and I want to get your medical advice for our viewers. We're seeing a lot of homemade masks, and with a wear a mask in public order that we've seen, unless you can socially distance yourself from 6 feet or further away from an individual. How does one, in between laundering those masks every day, what do you recommend they do to keep them clean? Because I've seen myself, I've laid it down on the dash of a car and I forgot which side I wore before. What can I do, and what can our viewers do to keep those masks sanitary and clean and avoid an exposure to COVID-19 unintentionally?
Well, a couple things. First of all, there's various processes on how to clean them and do those properly. They'll tell you just hot soap, water, that stuff does very good for COVID. One of the big things is, and one of the reasons you wear a mask, and you're protecting other people, obviously, but you don't really want to keep touching it, because not only from a respiratory standpoint does COVID spread, but it also spreads from your hands, from hands to face, right? On that, you touch something and you get that. So I think keeping that on a regular, clean basis, just going by any of the number of protocols that you can use. I think, remember, the mask is important to protect others. So if by chance you're carrying it, you're symptomatic, or if you're symptomatic, you probably should be at home, right? But if you're asymptomatic and you might have it, okay, then not to give that to other folks. So wearing that mask is really important from that standpoint. And we do it, obviously, we wear surgical masks and N95s depending on the procedures at our facilities. But the CDC, as you said, recommends cloth coverings out in the community. That may largely be to sort of preserve the other masks for the healthcare facilities and those types of things.
Well, I appreciate your advice there. Now's the time in our broadcast where we allow our viewer comments and any questions to come up. Jim Cooley says, hello, Rodney and all. Hi, Jim. We'll see if we have any questions pop up too. I'd love to get you with one last one. I'd love to, go Salukis. Abby, thanks for
Yes.
making sure that Doc knows where your both your loyalties lie, and Sonia Reese up at OSF in Bloomington, or at Advocate Broman in Bloomington, says, hi, Rodney and Ken, this is a big issue. So with that, we really appreciate our viewers. We really appreciate the comments. And, our primary goal today, Scott, is the question we have. Scott, our primary goal today is to make sure people know that they can get access to healthcare in Springfield and throughout the state of Illinois. The governor was offered advice. The governor and his team listened. Thank you, Governor Pritzker, for that.
Absolutely.
Now, this is our chance from the chief medical officer of the Springfield Clinic to tell you, Scott, and everyone else who's watching this, that it is going to be safe to go get access to care. Don't be afraid to go get your diagnostic tests. They're going to do their due diligence to mitigate the risk, and they're going to make sure that you get access to the health care that you deserve. So with that, Dr. Ken Sagins, thank you for your time today. Thank you for Springfield Clinic's willingness to serve this area and my constituents. I really appreciate you coming on and being a part of Live with Rodney, another COVID emergency broadcast. And we'll look forward to the next one. But until then, thank you, Doctor, and we're signing off.
Thank you for having me. Appreciate it. Take care.
Thanks. You too.